If you are over 50 and you think masturbation harms your body, you need to hear this. In my clinic, I meet men who avoid it out of fear. Many of them end up with more prostate problems, not less. So the real question is simple. Are you helping your prostate or slowly hurting it without knowing? Pause for a second. Most men get this wrong. Hi, I'm Dr. Ross. Today we're talking about masturbation after 50 and what it truly does to your prostate, your hormones, and your sexual health. By the end of this video, you will know what is safe, what is risky, and what doctors quietly recommend but rarely say openly. There are two things coming later you need to watch for. One is a common mistake that can reduce sensitivity over time. The second is a hidden benefit many men over 50 are missing. Stay with me. Later, I will show you the exact frequency linked with better prostate health. I will also explain a warning sign many men ignore until it becomes serious. And there is one myth most men believe that is completely wrong. Let's start with the real issue. As you age, your prostate changes. This small gland sits below your bladder. It helps produce fluid that becomes part of semen. After 50, it often begins to grow larger. This is called an enlarged prostate. Simple meaning, the gland increases in size. Now here's the problem. A larger prostate presses on your urinary tract. You may notice slow urine flow. You may feel like your bladder is not empty. You may wake up at night to urinate. In my clinic, I see many patients with this problem. Some think it is normal aging and ignore it. That is a mistake, because your daily habits, including your sexual habits, affect how this gland behaves. Let me ask you something. Have you noticed changes in your urination after 50? If yes, your prostate is already involved. This is not a rare issue. This is common in men over 40, and even more common after 50. If you are over 50, your risk is already higher. If your father or brother had prostate problems, your risk increases further. If you sit for long hours, move less, or carry extra weight, your risk increases again. Another group at risk are men who stop all sexual activity. That includes both sex and masturbation. Here is a surprising fact. Men who go long periods without ejaculation often report more prostate discomfort. Many people do not expect that. So why does this happen? Let me explain in simple terms. Your prostate produces fluid. This fluid needs to be released through ejaculation. If that does not happen regularly, the fluid stays inside. Over time, this can lead to congestion. Think of it like a system that is not being cleared. When fluid sits too long, irritation can start. That irritation is called inflammation. Inflammation inside the prostate leads to swelling, discomfort, and sometimes infection. Another factor is hormones. As you age, testosterone changes. At the same time, another hormone continues to act on the prostate and supports its growth. This is why enlargement becomes more common with age. Now here is an important point. Regular ejaculation helps reduce fluid buildup. It supports normal function of the gland. Doctors usually recommend maintaining healthy sexual activity for this reason. Now let's talk about what you might feel. Some symptoms are mild at first. Others become more noticeable with time. You may notice slower urine flow. You may feel like you need to urinate more often. You may wake up at night to urinate. Some men feel pressure in the lower abdomen. Some feel discomfort after ejaculation. Let me make this simple for you. Check yourself with these questions. Do you urinate more than before? Do you wake up at night to urinate? Do you feel weak urine flow? Do you feel pressure in your lower abdomen? Do you feel discomfort after ejaculation? If you said yes to even 2 of these, your prostate needs attention. Do not ignore it. Now let's talk about why this matters. A prostate problem does not stay the same if ignored. It gets worse. An enlarged prostate can block urine flow. In severe cases, you may not be able to urinate at all. That becomes an emergency. Another issue is long-term inflammation. When inflammation stays for a long time, it damages tissue. Here's another surprising fact. long-term inflammation creates an unhealthy environment inside the prostate. This increases the risk of more serious conditions over time. Also, prostate health affects your sexual function. Many men with prostate issues report weaker erections or reduced ejaculation strength. So this is not only about urination. It affects your sleep, your comfort, and your confidence. Now let's clear a belief many men have. Many think stopping masturbation protects their body. That is not correct. In some cases, complete avoidance leads to more congestion in the prostate. This is the twist. What you avoid might be something your body needs in the right amount. In my clinic, I had a patient, 62 years old. He stopped all sexual activity for years because he believed it was harmful. He later came in with pelvic discomfort and urinary issues. After proper guidance and gradual return to healthy sexual activity, his symptoms improved. This is real. Now let's separate myth from fact. Many believe masturbation after 50 is harmful. Medical evidence shows it is safe when done properly and in moderation. Many believe older men should stop sexual activity. Your body still needs regular function to stay healthy. Many believe less activity reduces risk. In many cases, balanced activity supports better health. Let me ask you one more question. What if something simple you already do could support your prostate health? That is what we're building toward. In the next part, you will learn the right frequency, the mistakes to avoid, and the exact way to do this safely. There is one mistake that slowly reduces sensitivity over time without you noticing. You need to know that. Now let's move deeper into what truly makes the difference. You now understand that your prostate needs regular function. But the next question is important. How often is healthy? And when does it become a problem? In my clinic, this is one of the most common questions men ask. There is no guesswork here. We have data. Large, long-term studies followed thousands of men for many years. The pattern is clear. Men who ejaculate more frequently tend to have better prostate outcomes compared to those who rarely do. The strongest benefit shows around 20 to 21 ejaculations per month. That is roughly 4 to 5 times per week. Let me explain this in a simple way. Your body works best with consistency. Not too little, not excessive, just steady and regular. Here is a question many men ask. If 4 to 5 times per week is good, is more better? Answer is no. Beyond a certain point, the benefit does not increase. In some cases, too much can lead to irritation. So balance matters. This is not about extremes. This is about control and rhythm. Surprise fact. Your prostate responds better to regular patterns than random bursts of activity. So if you go long periods without ejaculation and then try to compensate, that is not ideal. Consistency matters more than intensity. Now let's talk about mistakes, because this is where many men damage their own progress without knowing. First mistake is dry stimulation. As you age, your skin becomes thinner and more sensitive. Without lubrication, friction increases. This can cause small injuries. These are not always visible, but they affect tissue over time. In my clinic, I have seen men with irritation and reduced sensitivity simply from repeated dry friction. Doctors usually recommend using proper lubrication. Water-based or silicone-based options work well. Second mistake is excessive pressure. Some men notice reduced sensitivity with age, so they increase grip force. This creates a cycle. More pressure leads to less sensitivity. Less sensitivity leads to even more pressure. Over time, this reduces natural response. Let me ask you something. Have you ever felt you need stronger stimulation than before? That is often the reason. Solution is simple. Use a lighter touch. Allow your body to respond naturally. Third mistake is rushing. Many men treat this like a quick task. That reduces the quality of ejaculation. It may not fully release prostate fluid. Slow and controlled stimulation leads to better emptying of the gland. This supports prostate health more effectively. Fourth mistake is overdependence on explicit content. This is important. Occasional use is not the issue. The problem comes with frequent and intense use. Your brain adapts. It begins to require stronger stimulation to respond. This affects natural arousal. Some men later struggle to respond during real intimacy. This is not a moral issue. This is a brain response issue, and it can be reversed with control and awareness. Fifth mistake is ignoring warning signs. This is serious. Pain during ejaculation is not normal. Burning during urination is not normal. Blood and semen is not normal. Difficulty ejaculating is not normal. These are signals. Your body is asking for attention. In my clinic, I always tell patients this. If your body changes, do not ignore it. Early attention prevents bigger problems. Now let's shift to another important benefit many men overlook. Mental health. When you ejaculate, your body releases several natural chemicals. Dopamine, which gives you a sense of reward. Oxytocin, which helps you relax. And serotonin, which supports mood balance. These are natural processes. No medication needed. This is why many men feel relaxed after ejaculation. Now here's something interesting. Men over 50 often deal with stress from work, finances, or health concerns. Regular sexual release can help regulate stress levels. In my clinic, I had a patient who struggled with sleep. He would wake up multiple times at night. We discussed simple lifestyle adjustments, including regular sexual release. Within weeks, his sleep improved. This is not magic. This is body chemistry. Another benefit is support for erectile function. Let me explain this clearly. An erection depends on blood flow. When you have regular erections, blood flows into the penile tissue. This keeps the tissue healthy. It maintains elasticity. If you stop all sexual activity, blood flow reduces over time. This can lead to weaker erections. This is why you hear the phrase, use it or lose it. And in this case, it is medically accurate. Surprise fact. Men who maintain regular erections tend to preserve function longer as they age. This does not mean constant activity. It means consistent activity. In my clinic, I treated a man whose partner was unavailable for a long period due to illness. He stopped all sexual activity. After some time, he noticed difficulty with erections. We slowly reintroduced regular stimulation. Over a few months, its function improved. This shows how the body responds to use. Now let's talk about something many men do not discuss. Guilt. Some men feel uncomfortable about masturbation due to upbringing or personal beliefs. Let me be clear from a medical standpoint. There is no evidence that moderate masturbation harms your body. In fact, when done properly, it supports several aspects of health. If you feel internal conflict, that is something to reflect on personally. But medically, there is no harm in healthy practice. Another quick question. Do you feel guilty after doing something that your body naturally supports? That is worth thinking about. Now let's talk about balance. If you are in a relationship, masturbation should not replace intimacy. It should exist alongside it. Both serve different roles. Clear communication with your partner helps avoid misunderstanding. In my clinic, I worked with a couple who had tension around this issue. The husband thought he was doing something wrong. The wife felt disconnected. After education and open discussion, they understood the health aspect. Their relationship improved. Information removes confusion. Now let's go into something critical. Control. Healthy behavior means you are in control, not the other way around. If this activity starts affecting your daily life, your work, or your relationships, then it needs attention. If you feel unable to stop, that is not about the act itself. That is about behavior control. And that is treatable. Most men do not fall into this category, but it is important to be aware. Let me give you another key point. Your body gives feedback. Always listen to it. If something feels off, slow down. If something causes discomfort, adjust your approach. If something continues, get it checked. Doctors usually recommend early evaluation rather than waiting. Here is another surprising fact. Many prostate issues are easier to manage when detected early. Waiting often makes treatment more complex, so paying attention now saves you stress later. Now let's connect everything. Frequency matters. Technique matters. Awareness matters. Your goal is not perfection. Your goal is consistency and safety. In the next part, I will show you exactly how to manage this long term. We will go into treatment, medications if needed, recovery timelines, lifestyle changes, and clear steps you can follow. And there is one common daily habit that quietly worsens prostate problems. Most men do it without knowing. You need to avoid that. Now let's bring everything together and focus on what you should do from today. You understand the problem. You understand the right frequency and the mistakes. Now the question is simple. How do you manage this safely long term? Let's start with diagnosis. Most men avoid checking their prostate because they feel fine. That is risky. In my clinic, I see many patients who had no major symptoms, yet their prostate was already enlarged. Doctors usually recommend basic screening after 50. This includes a PSA blood test and sometimes a physical exam of the prostate. Simple tests, quick process, but very important. Let me ask you this. When was the last time you checked your prostate? If you cannot remember, it is time to take it seriously. If your prostate is already enlarged or irritated, treatment depends on severity. For mild cases, lifestyle changes and regular ejaculation help improve symptoms. For moderate cases, medications are used. For severe cases, procedures may be required. But here is the key point. Most men fall into the mild to moderate category. That means you have control. Doctors usually recommend starting with simple steps before anything else. Now let's talk about medicines. There are two common types. First, alpha blockers. These help relax the muscles around the prostate and bladder. This improves urine flow. Second, 5-alpha reductase inhibitors. These reduce the size of the prostate over time. Both are effective when used properly. But not every man needs medication. Many men improve with lifestyle adjustments alone. This is why early action matters. Now let's talk about recovery timeline. If you start making the right changes today, when will you see results? For mild symptoms, some men notice improvement within a few weeks. Better urine flow, less night urination, reduced discomfort. For more established issues, it may take a few months. Consistency is the key. Your body responds over time, not overnight. Now let's focus on lifestyle changes. This is where many men ignore simple solutions. First, stay physically active. Even simple walking improves blood flow and reduces pressure in the pelvic area. Second, manage your weight. Excess weight increases pressure on the bladder and prostate. Third, reduce caffeine and alcohol. These irritate the bladder and worsen urinary symptoms. Fourth, drink water properly. Not too little, not excessive at night. Balance matters. Surprise fact, dehydration can irritate the bladder and worsen symptoms, even if you think drinking less will help. Now let's go into clear do and don't. Do maintain regular ejaculation. Do use proper lubrication. Do pay attention to your body signals. Do maintain a balanced lifestyle. Don't rush the process. Don't use excessive pressure. Don't ignore pain or discomfort. Don't depend on extreme stimulation. Simple rules, but they make a big difference. Now let's talk about home tips. These are small changes you can start immediately. Take warm baths if you feel pelvic discomfort. This helps relax muscles in that area. Practice pelvic floor relaxation. Many men tighten this area without knowing. Relaxation improves function. Avoid sitting for long periods without breaks. Stand up, stretch, move around. Another important tip: empty your bladder fully. Do not rush when urinating. This reduces pressure on the prostate. Now let's talk about prevention. This is where you stay ahead. Regular ejaculation helps prevent fluid buildup. Healthy diet supports hormone balance. Physical activity supports blood flow. Routine checkups detect problems early. This is not complicated, but it requires consistency. Now let's look at common mistakes people make. Ignoring early symptoms, using too much force during stimulation, going long periods without ejaculation, then overdoing it, relying on misinformation from friends or the internet, avoiding medical checkups due to fear. In my clinic, these are the patterns I see again and again, and most of them are preventable. Now here are important tips doctors want you to know. Your prostate needs regular function. Your body responds better to consistency than extremes. Pain is a signal, not something to ignore. Early action saves you from complicated treatment later. And here is one more surprise fact. Many prostate problems improve significantly with simple lifestyle changes before medication is even needed. Now let's talk about when to see a doctor. Do not wait if you notice any of these. Pain during ejaculation, blood and urine or semen, severe difficulty urinating, sudden loss of bladder control. These are not normal signs. Get checked early. It makes treatment easier and more effective. Now let's bring everything together. Masturbation after 50 is not harmful when done properly. It supports prostate function. It helps reduce fluid buildup. It supports erectile health. It helps with stress and sleep, but only when done with the right approach. Frequency matters. Technique matters. Awareness matters. You are not too old for sexual health. In fact, this stage of life is when you need to take it more seriously. Let me leave you with this. Your prostate health is not controlled by chance. It is shaped by your daily habits. What you do consistently will determine how you feel in the coming years. Take control now. Do not wait for symptoms to get worse. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If this helped you understand your body better, make sure you subscribe so you do not miss more simple and practical health guidance. Like this video and share it with someone who needs this information. Drop a comment and tell me where you are watching from. Thanks for watching. Take care of your health, and I will see you in the next video.